I describe my look myself as an extreme, exotic, real-life Barbie.
What's going on here?
Curvy glamour model Martina Big has made a career out of her extreme Barbie doll look. But her new tan has shocked even her most dedicated of fans.
She's white, but she doesn't look white.
I asked my doctor, I have problems to get tanned. I want to be crispy brown. Do you know a way? And he knows a really good solution.
Okay, so she was made brown by her doctor.
I'm also listed under meth addiction and child psychiatry.
And that's not even to count. Her implants are massive. Have you seen breasts this big? Oh my gosh, let's learn more.
I got from my doctor 3 injections, and beginning from the first week, I am getting darker, darker and darker.
There is a medication that's pretty much been outlawed throughout the whole world called melanotan. Melanotan is made up of melanocyte-stimulating hormone, and this is a hormone that can stimulate your melanocytes to basically increase their function. Melanocytes are the parts of your skin that create the pigment, and so if you take melanotan, it can make your skin look like you're more tanned. But she's not tanned, she is like really, really dark. So is there something different that she's using, or is it actually melanotan?
You can see a little bit different.
The injection was 9 weeks ago. Each week I getting a little bit darker and a little bit darker, and I'm a little bit browner than I first expected.
Now, melanotan is outlawed pretty much throughout the whole world because of major complications. You can get nausea, you can get vomiting, you can get skin eruptions. And interestingly enough, the medication is also occasionally used for erectile dysfunction. So you can get painful, lasting erections from using melanotan. Don't use it, dudes.
I want to have really dark skin because I like the nice contrast of my long blonde hairs, and some are dark skin. Maybe I'm a little bit addicted to this crispy tan, but most addicted I'm for my boobs.
All right, she has massive breast implants, and there's no way that these implants are 800 cc's. Now, 800 cc's is the largest size breast implant that we make here in the United States. I have to guess that she's like 2,000 plus cc's, as big and as round as her breasts are. So how do they get that big?
Martina's loving boyfriend Michael also had the tanning injections.
So a lot of people asked Martina, is this a fake tan? Is this a spray or cream? But it isn't fake tan, it is a real tan.
This is just really, really strange. Like, that guy looks really weird too. I mean, what are they doing with their skin? Now, melanotan is something that's never really been used here much in the United States, so I have no idea. Is this reversible? Does it increase your risk of, let's say, cancer? I don't know.
I like the tan which Martina has right now very much. It's a very exotic look. It's a great feeling for me that Martina now have the biggest breast in Europe, and I think in the course of time it will be the biggest breast in the world.
He's so proud of her. I mean, the way he's talking, he's like so excited. He's like a giddy schoolboy. Now, it sounds like she has the largest breasts in Europe, which I don't know how you keep track of that. How big do you have to get to have the largest breasts in the world?
My first procedures started in May 2012. In the past, I wanted to look like Pamela Anderson and Katie Price, but her curves are too small, and now I'm a little bit like Jessica Rabbit.
She thinks she looks like Jessica Rabbit? Let's show what Jessica Rabbit looks like, and let's show what she looks like. I don't see a resemblance here. Do you guys see a resemblance? I don't see one.
The former air hostess has had over 20 different surgeries and procedures to date. She has spent more than $60,000 on her striking look and has even had breast implants that can be further pumped up without having to go back under the knife.
So that explains how her breasts are so big. There are breast implants that are called tissue expanders, and they're often used when we do breast reconstruction to try to stretch out, let's say, breast tissue for accommodation of a certain size implant. Now, if you take a tissue expander, there's actually a port that you can stick a needle into and you can fill the expander that way. And we do that in the office quite often in reconstruction patients. But like any type of strong balloon, you can actually overfill an expander. And in this situation, you can overfill it to these massive proportions and they technically won't break until they break. Now, I actually conducted a test many years ago where I took basically an expander type of an implant and I filled it with 3,000 cc's or so of saline, and it just kept getting bigger and bigger and bigger, and it wouldn't pop. But tell that to Mary Sebastian Pickles Magdalene, who recently had one of her massive breast implants pop, and you can see it is not a good situation.
With a hose like this to my implant, and then connect the valve and pumps up.
Oh geez, do not do this at home. This is something that must be done sterilely. If she introduces bacteria through that needle, bacteria that can be sitting on the surface of the skin, and that bacteria gets to the implant can get infected, she can get an abscess, she could get really sick, and she can actually die from it. So you do not want to fill your own breast implants at home. I mean, you would think that most people would have the common sense to know that that is not something that you should do.
My next procedure is enhancing my lips again, pumping up my boobs, and in end of summer, my butt implants.
So why would she do butt implants and not a BBL, or fat into the buttocks? Well, if you inject fat into the buttocks, you can only get the buttocks so large depending on how much fat she has on her body. Now, she's not a tiny little waif, but she also doesn't appear to have a ton of extra fat there. So if she wants to have a certain large size, that's why I'm assuming she's going with butt implants. Now, I do not recommend butt implants. That area is not a clean part of the body, so there is a risk of infection. There's a risk of those implants moving out of place. Just in general, not a good surgery to have done.
Martina is intent on becoming as dark as she possibly can, but is adamant that she is not trying to change her race.
A lot of people ask me, are you going to copy an African girl? And no, I look like an African girl. I'm not going to change my race. I'm going to create a unique, exotic Barbie look.
So I'd like to hear from any of my black and brown skin followers. What do you think of her? Do you find this to be offensive, that she's doing this with her skin? I mean, what do you think? It's just so bizarre.
I think Martina follows her heart. Our dreams are the same, and from change to change, Martina becomes more beautiful and beautiful.
Well, you know what? In the end, it's her body, and if she's happy with her body, then I guess all the more power to her. I would not do any of these procedures. I think that melanotan that she's taking is probably quite dangerous, as well as her DIY breast implant stuff, but it's her life.
I'm going to hold this dark skin, but I'm going to push it to the darker side.
All right, I don't know what to make of her, but there actually was a woman with larger breasts than her. So she said she has the largest breasts in Europe. How about somebody who has about the largest breasts here in the United States? Take a peek at this video right up here where I react to her breast issues, and you will be shocked at what she does with them. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.